In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Taskforce for Combating Coronavirus, His Excellency Dr. Walid Al-Mani, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we begin with Dr. Walid Al-Mani, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings. Praise be to the Prophet. I'd like to welcome you all to this press conference through which we aim at informing you on the most recent updates regarding dealing with COVID-19 in the Kingdom of Bahrain. Well, as we all know, we've witnessed the increase in the active cases, which reached 2,355 cases, and this goes in line with the PCR tests conducted in order to reach the active cases and treat them. And people might wonder why they conducting the large number of the PCR daily and why not reducing these PCR tests. Well, speaking about statistics, it is about relativity. If you reduce the test, you will discover less active cases, and that's why some countries have that sort of methodology. And we note that our main aim is to protect the health of everyone, and if we leave behind active cases which have underlying diseases, it would be possible that would cause death rates, and this nobody would wish. All we care about is the truth, away from anything not true or accurate. So our methodology in our medical task force is credibility and transparency, and this is open between us and you as society. This trust is built on this transparency. So the large number of the active cases, which are increasing on a daily basis, requires every individual of us to stop and wonder, are we really implementing all the precautionary measures? And I think these points are very important, and I wish everyone, God forbids, like got the infection or was exposed to contacts, should think about that. And are they really implementing these precautionary measures? Number 2, are they refraining from gatherings, especially outside the family framework? And third, are they really committed to taking the vaccine? So we ensure everyone that these are based on statistics by tracking teams, and this reflects reality. So please do not underestimate these 3 points or doubt about them, because some people would, as a result, go reckless. And those who speak about reducing the access from ports to Bahrain, we would like to note that the variants are spread everywhere. So all we're saying is like receiving people to the Kingdom of Bahrain. The main thing we're talking about, that variants are many, and they are all around the world. So the solution is not about stopping or reducing the access of those arriving to Bahrain, but also by fully complying with all the precautionary measures and urging the members of the family and society to comply with all these instructions, and the results show that the active cases are mainly because of the contacts within this family and not from outside the kingdom. That's why the number of the active cases coming from outside Bahrain are only 14 cases out of 2,354 cases. And I would like to note that the variants could be through the ports, or it could be through the same country. But what makes it even worse is that people are not complying with the measures and guidelines, and that's what happened in other countries. The main reasons having this variant going into a different level of spread is because people are not implementing the guidelines. And the statistics proved that the percentage of the positive cases coming to Bahrain during April was only 1.76%. And despite its limited percentage of the arrivals, we still have strict guidelines, and we still require the presence of PCR before coming to Bahrain, which proves that it was taken 74 hours before the arrival of Bahrain, and also upon their arrival and on the 5th day and on the 10th day. And we have institutional quarantine for those coming from countries which have large spread of the virus. We are at a very sensitive stage, requires everyone to be one hand to avoid the increase in the active cases. We realize that the pandemic has imposed new lifestyles, and this is all around the world. Since the announcement of the virus in 2019, but this is exceptional globally and is not related to Bahrain only, and we shall continue implementing all the precautionary measures and guidelines. And today, more than ever, we count on your awareness and commitment. The responsibility of protecting family and beloved ones and also our surroundings is a shared responsibility, requires us to fully comply all the guidelines. And I believe that even the implementation or the application was called Be Aware. And the statistics showed that the active cases of Bahrainis out of the total number is 60%, while the active cases of kids aged from 1 to 18 is 42%. And this is very important. Shows that most of the active cases, if we're talking about today, is 42 for kids, for children, even below 18, and those are non-vaccinated children, and their movement and interaction in society. So that's why we had an increase. So we call upon everyone to take the initiative and take the vaccines. Bahrain is all of their citizens and residents, children, elderly, all their frontliners, and all the supporting entities. So we call upon everyone to be serious in implementing these guidelines. And throughout dealing with this pandemic, it showed that our collaboration and implementing all the precautionary measures have helped in reducing the active cases. The Medical Taskforce had some procedures, and they were professionally implemented, and there was, in every stage, it had an impact depending on how people follow and implement them. And so together we can overcome this stage by taking the vaccine and fully implementing the precautionary measures and the related decisions. So the vaccine is among our main major weapons. And we confirm that the National Medical Taskforce is following all the updates related to COVID-19, and we're analyzing the local context and compare it to the international level. So I think our team, we have great information, and rest assured that these information, once we receive them from different sourced, sourced and non-sourced. So we collect them all, analyze them, and help in developing the plans. And we also have supporting decisions in tracking the violations. So our inspections are ongoing, and there is no sector open without being inspected, ensuring that they fully comply with the instructions. I think with the increase, we have a responsibility, a personal responsibility on everyone, on every individual. Yes, we have inspections, but there is also a responsibility on every one of us. And we announce all the inspections on every sector, and we take the legal actions accordingly. Sometimes they lead to closure of these sectors. And despite that, we've seen an increase in the active cases because of the Ramadan gatherings and Eid al-Fitr gatherings, and the numbers increased in unprecedented numbers. Let's review the statistics of last Thursday, 13th of May. On Thursday, 13th of May, we registered 1,816 new active cases. The tracking mechanism showed that the main source was the gatherings within family gatherings, and citizens represented 59% of the total active cases. And for the citizens out of the was around 60%. So we are at a new challenge. We need to reduce the active cases and go to the previous safe levels. That's why this requires every individual to reconsider to what extent they comply with these instructions. And every family should reconsider their gatherings at homes and limit their gatherings to the small household gatherings. And also keep in mind when they interact with the elderly. And based on the increase recently, it has been announced and decided starting from tomorrow, Friday, 21st, up to 3rd of June, the malls, access to malls will be only limited to those who took the vaccines and they finished 14 days, and they have to show the proof of Be Aware logo, green logo, and only above 18 years old. It was before okay below 18, but now only those who are above 18 years old. Also, access to markets and shopping centers will be only limited to those who took the vaccines and they have finished 14 days after the second dose, and they have to show the green logo on Be Aware application, with the exception of supermarkets, banks, and pharmacies and hospitals. Also, the indoor services of like restaurants, cinemas, salons, and etc. will be only limited to those who took the vaccines by the proof of their green logo on Be Aware, and only for those above the 18 years old. And also the presence of those benefiting from the services at government entities will be only limited to those who took the vaccines, showing the green logo on Be Aware, and they should be also above 18 years old. And to gatherings, the private gatherings should be encouraged to be only limited to 6 persons only. So it was before like 30 persons, but now we urge everyone to just be limited to 6 individuals. As for those coming to Bahrain from India, Pakistan, Sri Lanka, Bangladesh, and Nepal, they will be only those accessing Bahrain to having the visas, and they will have 10 days quarantine, and all those arriving to Bahrain should present certificate that prove the PCR test with a QR code and before 48 hours of arrival. And they should also, upon their arrival, to conduct the PCR test for those who will stay in Bahrain for more than 5 days, and for a third PCR test for those who are going to stay in Bahrain for more than 10 days. To conclude, we remind everyone that fighting this virus would require us to continue implementing all the precautionary measures and refrain from the gatherings, and also to take the vaccine, which proved its efficacy, as we have shown through numbers and figures. And all of that in order to reach our ultimate goal, which is to combat the virus in order to safeguard the health and safety of everyone. Now, I'll leave the floor to my brother, Dr. Manaf Al-Qahtani, infectious disease consultant at the BDF Hospital. Please proceed. Thank you very much, Dr. Walid Al-Mana. You've well said. Thank you. In the name of God, most gracious, most merciful, good afternoon. There are a number of things I want to say from the depth of my heart. I think I mentioned something from the beginning of the press conferences, and I shall remind myself before you. We shall not gain victory over this without the collaboration. Yes, we are at a very challenge, but through the help of God and by the assistance of God, we're going to combat this pandemic. We started with you, we continued with you, and we have the determination to stay with you to protect you. So our game is one, to have our beloved kingdom to combat this virus. Everyone noticed the increase, the rapid increase recently. And many of you, there are so many questions. Questions related, like the reasons for this increase. Is it related to an increase like in taking the vaccines? Are there other reasons other than the gatherings, like the variants? Are we going to take more strict decisions like mentioned by Dr. Walid Al-Mana? As mentioned by Dr. Walid, it is very important before we ask these questions, we should ask ourselves, while seeing these numbers, we don't look at them as figures, we look at them as souls, as people. Was I one of the reasons that led to this increase? Was I one of those reasons? So we have to take serious stand, citizens and residents, to change this quickly and rapidly. I believe in, contacting the society and exposing truth. At this stage, people now are confused. What is truth? What is false? In many press conferences, we based on announcing the decisions on a transparent, credible manner. But let me remind you, before hearing my speech, please listen carefully, because these numbers that I'm going to announce are based on local context, and there are so many information that are going to expose the false allegations. And I also believe that sometimes worrying could cause some issues, but creating this issue would really confuse people and would lead some people to take non-accurate decisions that would have an impact on themselves and their families. So, as usual, I'm going to talk about figures and numbers that would and answer all the questions that I think many people in the Bahraini community will ask them. First, the percentage of those not vaccinated, 94% of the total active cases, and we mentioned that in previous press conferences. Since the announcement of while those vaccinated was only 6%, so only 6% of the total active cases were vaccinated, while 94% for those non-vaccinated. The number of those took the first dose was more than 861,398, while those took the second dose 657,975, and for those who took the two doses and they finished the 2 weeks period, over 558,000. So that means that the country provided the vaccine for you, which we believe is the main means in order to combat this virus. And the figures prove that clinically and in real life. That's why we say, why do we need to say that the vaccines are the reason of the increase? We already said it's not going to protect you 100%, but for those, there is no house in Bahrain with vaccinated. They know that. They will know this. And we hope that by 1st of July, that we will reach the vaccinated to 78% out of the total people qualified. And by the 15th of July 2021, I think we might reach 87%. This confirms that there is a plan we are implementing. We provided the vaccines according to those qualified to take the vaccine. We don't have shortage of the vaccines. We believe in the vaccine as a means to combat the virus, so we provided it for people. Within this increase, so your brothers and sisters in the medical task force have not just stopped. Yes, we see the increase, but we don't see an active case without providing the treatment, and we've increased the capacity for beds, the medical team, we've increased the conducting the tests, we've increased the number of the vaccines, 12,000 to 15,000. We changed the classification. We changed a bit in Ash-Shamil Center. So there are so many positive things. Why do we look on the numbers and we forget about our work? We're trying to fill the gaps. So the best question, do we have collaboration by everyone in order to have this plan effective? The percentage for those took the vaccines and they completed 14 days after the second dose, we've only 37.2% out of the total number of the population. So we have a long way in order to complete. So by July, we should complete the percentage of those qualified to take the vaccine, which is like 48.6% of those qualified to take the vaccine. So all I'm saying, and this is the second point, which is really important, how the vaccine is efficient in avoiding any catastrophe. So let's review the active cases. For those active cases and non-active, for vaccinated or non-vaccinated. For those took the vaccines, who finished the 14 days and they did not take, who did not get infection, they are 98% of those who took the vaccines. While only 2% of the vaccinated, they got the infection. So a large number of those vaccinated, 98%, did not get the infection. Only 2% of them, as you can see on the figures. So the majority of them did not complain of any symptoms and they did not need treatment. This proves that taking the vaccines is the only means to get out of this pandemic. And let's ignore those false allegations raised by some people that vaccine is not effective and that it caused an increase in the active cases, but the figures show the opposite, that the vaccines, and this is in parallel to the other information published globally. We have 4 vaccines approved in the Kingdom of Bahrain. All of them are efficient. They proved to be are equal in efficiency, and that the percentage of those vaccinated for all the types of the vaccines is at the range of 1% to 2%, while taking into consideration that a large number of those vaccinated, whether first dose or second dose, did not comply to the precautionary measures which we repeatedly mentioned. Antibodies differ from one person to another. Could take 2 weeks, and sometimes it requires more than 2 weeks. That's why we urge everyone to take until we reach the percentage that we hoped, like in April, but hopefully by July. And I point out, for example, the death rates out of those took the vaccines and they completed 2 weeks from April up to May 19th of May. The death rates from April up to yesterday, they were only 422, and only 6% of those were vaccinated. So that means 94% of the death rates, my God's peace, may rest in peace, they were not vaccinated. May their souls rest in peace. And just yesterday, in the 19th of May, we had 8 cases, active cases, 8 death cases. 7 of them, they were not vaccinated, and only 1 was vaccinated. So even the daily cases, the death rates are large for those non-vaccinated. That's why we repeat it over and over. Please, if you're not of specialty, please don't spread false allegations by saying that vaccines were among the reasons of increasing the active cases, because we all have the figures and statistics. Some people unfortunately insist on go reckless in implementing the measures. They have like pride and they violating the guidelines, especially in terms of gatherings, is something that we mentioned. Like, people sometimes got bored. They're looking for, we wish like we have something different, but this is reality. Gatherings were among the reasons for the increase. And these gatherings, we noticed the largest groups who are mostly exposed to this virus are the children who are non-vaccinated. And we've seen an increase in the number of those children. And thank God, up to now, they are usually mild, but we don't wish that they might require, for example, sensitive levels. So if you don't consider yourself, please consider your children, your family. Let's protect them. And that's why we vaccinated them. And among the decisions we decided is in order to protect children. And within the same context, just to remind you that the Kingdom of Bahrain has allowed the age group between 12 to 17 to take the vaccine. And we urge all the guardians to register their children to take the vaccine because it is a protection for them. And we do not wish to lose a single soul of children because of false allegations. And those allegations will be responsible for that, God forbids. And also, we announced previously that we started giving the booster dose, which is as a proactive step for those mostly exposed to the virus, those frontliners, the elderly who got over 50 years old, and also for citizens who have obesity. And according to the statistics of the Kingdom of Bahrain, we announced they can now take the booster dose for those who took Sinopharm in order to create antibodies to be more efficient. Last but not least, I started with something that we are going through a challenge, but I do believe that we're going to go through this by the assistance of God. And before everything, we have God who will provide us with determination to combat this virus. 16 months, we're working 24 hours. We have the same determination. Your team, brothers and sisters in the Bahrain team, are going to provide you with the accurate information. We're going on protecting our community and our kingdom. Now, I'll leave the floor to Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmani Medical Complex. Thank you very much, Dr. Manaf. In the name of God, most gracious, most merciful, I welcome you all, and let's continue talking about the updates dealing with COVID-19 at the Kingdom of Bahrain. I want to shed light on 3 points that are important. Some of them, like mentioned by Dr. Walid and sometimes by Dr. Manaf, because they are important. The first point, which many questions were raised about, and people are worried about, is the increase of the active cases in the Kingdom of Bahrain because of COVID-19. Well, all of this, as mentioned by my colleagues, all the figures showed because people were not fully implementing the guidelines and instructions. There is something basic about COVID-19. It is a disease through a virus we all know about, and we all know how to protect ourselves. So how the virus increased? Because people were not complying to the precautionary measures, which were the basic things for any other virus similar to COVID-19. So there is nothing much different. So we have to strictly implement these guidelines. And as we repeatedly mentioned before, in many press conferences, the theory of the spread or reduction, it's all on us, on how we deal with the virus and how we can reduce the percentage of this spread by just implementing them. Just the degree of implementing. The more we implement them strictly, the more we will reduce the active cases. And you've seen some families, some members, some individuals, they did not get any virus because they were fully implementing. And some maybe they repeatedly got the virus within the same family framework, and this is really important, shows what I was just saying. So Bahrain citizens and residents, they have achieved success since the beginning of the virus. So we do not want the virus to, it's been more than a year. So we don't need to go reckless in implementing them, as we have seen the results now. The second point, which I think is important and point out, our brothers and sisters, your brothers and sisters at the front line, they are the ones protecting you, and they really need your support in implementing all the precautionary measures. There are so many medical team and nursing teams at the front line, they never got a chance to sit or visit their families or sit with their children or families for months because they were working 24 hours for months. And they are ready to provide even more. But such giving to us would require us at least to give back to them. So it is important for us, for our families, for our country. Please, let's implement all the precautionary measures and guidelines. The third point, which is very important, as mentioned by Dr. Manaf, the figures, they show the efficiency of the vaccines. They are clear. They reduce the spread rate from one person to another. They reduce the infection. They reduce the symptoms that a person could get if they got the infection. So in total, more than 90% of the active cases in Bahrain, because of those non-vaccinated. Those 90% of the ICU, they are of those non-vaccinated. Over 90% of those of death cases because they were not vaccinated. So all these figures, they show this. At this stage, we need to really take the vaccines and at the same time implement the guidelines and instructions. The increase in the active cases has nothing to do with the increase of taking the vaccines. So to conclude, I would like to remind you, please implement the precautionary measures. I don't think it's an option. I think it's important. It's a national duty. It's a religious responsibility. Let's do that within the coming 2 weeks, and we will reduce the active cases to a safe level by the collaboration of everyone. Thank you very much. Now, thank you very much, the speakers, for your briefs. And now we take the questions of the reporters and journalists who are following us remotely. First question to Dr. Walid Al-Mana from Samahar Saif Al-Watan newspaper. What is it true about having the Indian variant in Bahrain and that it's difficult to reach the emergency and Salmania Medical Complex and the delay of the ambulance services because of the load of the active cases? Yes. Well, as for the Indian variant, or what they call it, the Indian variant, it is, yes, in Bahrain as any other variant. So recently we identified as specialists, I think Dr. Manaf have some details. So the variants are in Bahrain even before. So if we're talking about like the pandemic in India, this variant has already been identified in Bahrain before the spread. So there are identification of some variants in Bahrain, and we are tracking their spread and how they are affecting the active cases. So is it in Bahrain? Yes, it is available as any other variants like the UK variant or the other variants. And the mutation could be even locally, as mentioned by Dr. Manaf, or it could be externally through the ports. But many allegations would be like the main reason because of these variants. It has medical impact, but we go again and again to say that it's not the main reason in the spread of the disease in any country. Any mutation of a variant will have spread, even if it's weak. Even if this variant is weak in terms of the medical impact, but if people are reckless in implementing the guidelines, definitely it will spread. So let's not link the variant or the new variant to its spread. Let's say the two things will cause if we have a new variant, but most importantly, it's about how people implement the guidelines. So about the emergency and about the ambulance services, well, if we have an increase in the active cases, we will have disease. So we have to keep this in mind. Maybe thank God, because of the vaccination, we reduced the number of the active cases admitted. So maybe 10% before, out like 1,000 would be 100. Now we have like 70 out of 1,000. So thank God, it's because of vaccination and its efficiency. As for ICU, emergency, sometimes people are like panic. And I think this is like a recommendation. There are channels for people, to reach out, and there are health centers who are following. So let's also, people, they should first think, do they really need the ambulance or no? As for the active cases, I think I don't have, figures, but definitely with the active cases, we will have an increase. And I think people should be really more committed. Question from Rachel Ibrahim from Bana to Dr. Manaf Al-Qahtani. When are we going to take the third dose? And do you recommend to take the same vaccine or different types? Thank you, Ms. Rasha. Just to clarify, and then people, they got misunderstood. If we're talking about the third dose, any dose after the first dose will be a booster dose. So if you take any dose after the first one, the second dose will be a booster dose as well. In pandemic epidemiology, there are boosters depending on the period, like 6 months or a year, depending on the health condition and the virus. The Kingdom of Bahrain, since March, based on our statistics who took certain type of vaccines, we've noticed that people were mostly exposed to the virus. So that's why a decision was taken by the vaccination committee that to allow to have a booster dose for 3 categories: those at the front line, and those with obesity, and the elderly who are over 50 years old. Those 3 categories who took the vaccine, Sinopharm, they are allowed to take the booster dose. Is it going to be the same vaccine as a recommendation, a medical recommendation? We said they take Pfizer because based on the studies conducted and presented on Pfizer, but at the same time, there are people who benefited from the booster dose. So it will be optional. The booster, you can take Pfizer or the same Sinopharm. And I confirm that there are studies conducted in the UK in February, and they will be presented in June. Part of them were presented this month, like 2 days ago. They showed the efficiency of the vaccine and the safety of taking 2 doses from different types of vaccines. And I confirm also the mixing the vaccines is not something new, but we need more studies. Coronavirus is among the same virus, so we don't have any issue if somebody wanted to take a different type of the vaccine. All of this will be based on studies that we're waiting for to read and see and to be approved by the country. Thank you. Question from Sidraj, Star Vision News, to Dr. Jamila. After getting the infection, there are black spots. So what would be the actions taken by Bahrain? I think, yes, this theory of this inflammation, well, this is usually related to those who have less immunity, who have a transplant of certain bodies of cancers, or even immunity sickness, even diabetes, even if it is not organized, so they will have such black those plots. So any infection, if they get any infection, if they go to hospital, for example, if they have the steroid medication, it will reduce the immunity and it would cause some fungus. So also the same question, mucormycosis, which is like the black dots. So such ones are related to the increase of the active cases in India, and this mucormycosis would be between 2 months to 6 months, and they noticed those are usually with COVID-19 or a non-organized diabetes, or they took the steroid as treatment. So such type of black dots that would cause extreme, they could cause to death. They are there in anywhere, but they are only exposed to those with low immunity, and you could see it in the nose, and it could go to the skin, and that's why it could cause some black dots, and it could go into the lungs as well. That's why it could be more reasons to have these black dots. It could be the low immunity, the COVID-19 itself, treatment like the steroid treatment. And so in order to protect from this, by just protecting yourself from COVID-19, and if you have any reasons like diabetes, we care about our health, and by protecting ourselves mainly from COVID-19 and taking the vaccines and implementing the precautionary measures. Question from Badur Al-Maliki to Dr. Walid Al-Mana. Within the increase of the active cases recently, what are the mechanisms of collaboration between the Medical Taskforce and the private hospitals? Especially some cases, especially the sensitive ones, would go to private hospitals. Are you going to collaborate? Thank you for the question. Just at the beginning, before the question, allow me to note 2 important points. First, the monitoring will be strict on those establishments and individuals. This is number 1. We will have strict monitoring and supervision on establishments and individuals. And number two, which is also important, we're talking about the vaccines and as a very important weapon in combating this virus. So we will expand in the vaccination centers with the provision of number of versions. So thank God, over the coming days, we're going to expand on all the vaccines available in the centers of the vaccinations. Well, going back to the question of Ms. Budur, the collaboration with the private sector, well, the health system is an integrated one, the private and public. So definitely, even the previous plans in pandemics, we deal with the private sector. And honestly, we dealt fruitfully from the beginning with private hospitals. Even the private ones, they allowed their access to treat some active cases. And also, the private sector largely contributed in conducting the tests in Bahrain in many private health centers. A very important point also, those sensitive cases, maybe the public sector is more qualified, relatively speaking, to receive those who need like ICU. So maybe we collaborate with the private sectors, like they can take the mild or medium active cases, so we don't have pressure on the public sector. So that's why we have collaboration, and we have plans to expand, like, for example, the tests, also the vaccinations. Sometimes maybe in the health centers, we do collaborate with the private sector, and it's going to be more over the coming days. Same from Saiju to GD. We have many, those coming from India, Pakistan, Sri Lanka, Nepal, they were informed of taking the 10 days quarantine. Does that apply to those who took the vaccines in Bahrain? Well, right now, the quarantine or these guidelines are depending on those coming from outside, like, for example, like India, Nepal, Pakistan, as we mentioned, we have strict measures. We're not implementing these strict on nationality, just to let you know. It's based on the destination. If they, like a Bahraini going to those countries and they're coming back, they will have the same measures. And it's not based on nationality or like their location, whether from Bahrain or like outside. So those coming to Bahrain from those aforementioned countries, they will have the same measures that we mentioned. They will have quarantine, the test, and the three tests upon their arrival. So whoever comes from those destinations will have the same implementation. That was the last question. We conclude the question and answer sections. Thank you for your briefs and answering the questions, and thank you, journalists, and you, ladies and gentlemen. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much.